Hi, we're going to do an instructional video today of the insertion of a Foley catheter in a male or patient with a penis. So, first thing you're going to do before you come into the room is you're going to make sure you have an order to do this insertion, and then you're going to gather your supplies, and I'm going to show you what the supplies are in a little bit. Hi, Mr. Jones, how are you doing today? Great. I heard you're having a little problem with some urine retention and some uncomfortableness in your bladder area. Is that correct? Yes. Okay. Your doctor has ordered me to go ahead and put in a Foley catheter. It's a urinary catheter that goes into your bladder. Have you ever had that before? Yes. Okay, great. Even though you have, let me just kind of go over what we're going to do today. I'm going to clean the genital area first. With soap and water. Then we are going to go ahead and insert the Foley catheter into the bladder. It shouldn't hurt. It might be a little uncomfortable or unusual feeling, but it shouldn't be painful. And then we will allow that to stay in place for a couple of days, help drain your bladder and make you feel more comfortable. And then after a couple of days, we'll probably take it out, and then you should be able to urinate on your own. Okay, do you have any questions? No? Okay. So before we get started, let me just check your name band. Your name is Jim Jones, and you have no allergy band on. I don't see one. Do you have any allergies to anything? No? Okay, including chlorhexidine? Great. Okay, so we are gonna go ahead and get started. First thing I'm gonna do is get supplies together and clean off this table. Okay. Here we're going to wipe this table down with some wipes. We'll take this off the bed, or off the tray table, and I'm going to wipe it down. And the way I usually do it is side to side first, and then back and forth. And then last but not least, I get all the edges. And the whole point of this is to make sure this is nice and saturated, and so that it will take a couple minutes to dry. We want it to dry for 2 minutes. Okay, so while that's drying, I'm going to go ahead and take off my gloves. I'm going to clean my hands. I'm going to put some gloves on, and I'm going to get Mr. Jones's supplies together. I'm also going to pull the privacy curtain, so let's go ahead and do that now so that we can provide privacy. Okay, now we're going to get all our supplies together. We're going to get warm soapy water and a washcloth, and we'll put that in there. We're going to get a towel, a chucks, and I'll bring some gloves over. We're going to assume that this table has now dried, so I'm going to put that stuff down here. Okay, the other thing I'm going to do is I'm going to bring in my Foley catheter supplies. Let me show you what I have. I have a Foley catheter kit. I have a securement device or a stat lock, a sterile syringe, and a CHG wipe that we're going to use for our urine collection. Okay? So we're going to get everything all set up and ready to go. Okay, so I'm going to go ahead and open up my kit and at least get it ready for use. I'm going to take this out of the bag. I'm going to create a little garbage bag that can be very handy at the foot of the bed. We'll get rid of this. We don't need that. We're going to, okay, so we're going to open it away from us first. Again, we have a 1-inch border we're working with. So I'm going to pull on the edges here. Come back here. Okay. Now, notice it's in a diamond shape. I'm going to turn it so that it is more of a square shape. Pull on this edge a little bit more. It's okay if you don't have a very big table and you need to move it more closer to that edge. That's okay. Everything that hangs off is not considered sterile, so don't use this edge going forward. Okay, we're going to drop this syringe in. We need to have a sterile syringe for our specimen. Does not want to open here. We're going to drop it in. We're going to put it kind of on the side here. Okay. We're going to drop our CHG wipe in. If you want to drop it in sterilely, you can tear it. And it fell right in. I got really lucky. We can move it once we have our sterile gloves on a little closer to the syringe. And last but not least is our stabilizer. Our stabilizer is sterile inside, but it doesn't need to remain sterile. But I'm going to put it away from my specimen collection stuff. Okay, so I have everything all put in one place. All right, so my tray's ready, everything else is ready. I'm gonna go ahead and change these gloves really quick because I've been messing with supplies and whatnot. And I'm gonna clean my hands, put some gloves on. Okay, Mr. Jones, we're gonna go ahead and get you all cleaned up. I've pulled the privacy curtain, so we're gonna pull down the gown, or pull up the gown and pull down the sheets and blankets. If he's a fragile little old man and you feel like he's gonna get cold, you can always put a nice warm blanket across the top here. Only expose what you need to expose. And we're gonna go ahead and ask him to open up his legs, kind of in a frog position. Okay, so before I do anything, I'm gonna put this chucks down in order to protect the bed, because we are using soap and water. Okay. All right, I'm gonna take my washcloth and holding the penis, I'm gonna start at the center and wipe down. Find another portion of the washcloth and wipe down. Find another portion of the washcloth and wipe down. You can do it 4 times or 3 times. There's not a real prescriptive way to do it. You're mostly trying to just remove any soil. Okay? All right. This is good. You can pat it dry. Okay. I'm going to take that and move that off the bed. Okay. So now that I've done all of that, I'm going to take these gloves off. Put them in my little garbage bag. Do some hand hygiene. I'm going to take this and move it down closer to me so I have what I need to work with. I actually just did like that. I just flipped it and the CHG wipe just went over by the syringe. So it was kind of convenient. Okay, now I need to put my gloves on. Okay, hand hygiene. Always hand hygiene before you put a pair of gloves on. Take those out. Before I do that, I'm going to take the sterile bed protector using no touch technique. Notice there's a shiny and a matte side. You want the shiny side down. And I'm just going to gently lay it in here. We'll use our sterile gloves later to place that a little better underneath the penis. And then this is our fenestrated drape. It's an optional use. You can use it to put it over, and I have used it with male patients. It tends to keep the area a little bit more secure, but you don't have to, so we're gonna not make you do that. Okay, I'm gonna put my sterile gloves on. Not the easiest gloves to put on. Well, that's great. All right. Make sure that cuff rolls down as much as possible. You don't want your cuff rolled up. Okay, we're good. You can leave that there. That's like another sterile space if you need it, or get rid of it, whatever makes you happy. Okay, so I'm gonna take my hand, it's sterile, and kind of put it right underneath the space where I need it to be. Okay? Okay, now I have in the kit, I have the swab sticks, I have the sterile water, and I have the lubricant. I do not need this anymore. I can put it over here. Inside is our Foley bag with the Foley catheter, and here's our sterile specimen. I'm going to put it over here by the specimen collecting supplies. Okay, so now I'm going to go ahead and apply everything. First of all, it doesn't really matter what order you do it in. Up to you. Again, there's a sheath that covers the Foley catheter. You want to have control of that. Get rid of that. And what was I do? Again, you're going to take the barrel, from the syringe, and you're going to take the Foley catheter and insert it here. Alrighty. Put that over there. The sterile water, we're going to go ahead, take that off, attach that there. Okay. And then our swab sticks, tear them and fold it. And this can go right here. So I'll turn it this way so it doesn't flap up too much. Okay, I think I have everything I need. All right, okay. I'm gonna take the box, I'm gonna place it down in here. It's gonna get creative, I think. I'm going to kind of gently touch that there. Okay, and gently put that there. Okay, now what I'm going to do is I'm going to clean the site. Okay, Mr. Jones, I'm going to clean everything here for you. I'm going to hold on to the penis, lift it up here a little bit. Clean from the inside out. Clean from the inside out. Clean from the inside out. Now, if you don't use that garbage bag like I have at the foot of the bed, you could easily just tuck it right here. It's totally fine. It's away from the sterile area. I'm just throwing it in the bag. I'm going to get rid of this so it's out of my way. Okay, so now I'm going to get ready to insert the Foley catheter. Again, move this out of my way. All right, so Mr. Jones, we're going to go ahead and insert the catheter. I'm going to have you take a deep breath, and then when I go 1, 2, 3, blow it out. When I say 3, blow that out, and we'll insert it. So take a deep breath. 1, 2, 3, blow it out. All right. We're going to go ahead and insert that until we see urine flashing back. In a male patient, it usually will go in fairly far, but for our purposes here today, we're going to stop there. Okay, now hang on to it here. You want to leave the you want to hold on to the catheter with your clean hand right now, because in case we have to adjust it, either in or out, we still maintain the cleanliness and sterility of this tubing here. Okay, I'm going to let go with this hand, and I'm going to reach over, and I'm going to go ahead and inflate the balloon. And then I'm going to walk my hand down really quickly and remove it from the port. And the reason why we do that is that if you leave the syringe in place there too long, it actually will allow the fluid to go back up into the syringe. It's going to the path of least resistance. So then we're going to go ahead and pull, retract until we meet resistance, and I just met resistance. So we are now in place. All right, Mr. Jones, how you doing? Did that go okay for you? Awesome. Okay, so now what we're going to do is we are going to go ahead and we're going to get this port ready to be cleaned and grab our urine specimen. So one way to help you collect that specimen is you can crease this over and use this to make a kink in the tubing. And that would be if you went and found you were not getting a lot of urine coming out and you needed to have that urine pool a little bit before you pull. The kinking off will help you to do that. So what I'm going to do is I'm going to reach over here. I'm going to grab my wipe by the corner and I'm going to apply it over the top of the port and then make a motion almost like I'm squeezing a lemon, trying to get juice out of it, juice it on a juicer. This is CHD, you're going to scrub for 5 seconds and then dry for 5 seconds. If this was alcohol, you would scrub for 15 seconds and dry for 15 seconds. So 1, 2, 3, 4, 5. I'm going to let that dry. Put that there. Wants to stick to my hands. Okay. Then we have our sterile specimen syringe. I'm going to apply that. Push and twist. Pull off 5 to 10 mLs of urine. And then we're going to go ahead and just place that right back over here. Okay? We're going to put that in the cup later. If you're using this little blue clip to clamp off the tubing, you do need to remove it. Okay? Then we're going to put it on the stabilizer. So, grabbing our stabilizer. Notice there's like a little lip right here and there's a bifurcation. We want to apply this to the tubing first and then we want to apply it to the patient, okay? You want to make sure that this stuff is up. You don't want this facing down, okay? So up. Snap. And notice that this can rotate, okay? So we're going to go ahead, bring this kind of up and is anterior, not interior, but towards the outside as much as possible for the patient. So if they get up and walk, this doesn't rub up against anything. So I'm going to go ahead and we'll secure that for right now. I'm just going to secure it with one side for right now for practice purposes, but you pull both these tabs off. Okay, and now we're going to take this. We're going to hang this below the level of the bladder. Usually there are little hooks on the sides of the beds or little holes to put these little hooks in. You don't want to put this on their side rails, okay? So it's going to hang below the side of the bed. Okay, so now we're just going to clean up everything up and out of the way. Go ahead and get everything. We're going to give them a little bit of privacy here. Okay. This is going to go in the garbage. And then I'm going to go ahead and change my gloves really quick. Do good hand hygiene, and we're going to take care of this specimen here. Okay, so now what we need to do is we need to open this cup, place the lid up. We're going to take the syringe. We're going to go ahead and insert it. Do it on a kind of slowly because you don't want to splash back. You also don't want to be deep inside the cup, so you can risk touching the inside of the cup. Go ahead and put that down. Reach for the lid from the outside. Place this, secure that. You'll have a label. You can stick that on, and then you can stick it in the bag that lets it go down to the lab. And then you're done with that. So now that we've done all of that, we can go ahead. I'm going to go ahead and cover him up. Help him get his legs back together. Cover him up with his... You doing okay, Mr. Jones? Awesome. I'm going to clean everything up. Okay. Put this in the garbage. Take off my gloves. Do good hand hygiene. Mr. Jones, if you're doing okay, I'm going to go ahead and go chart on what we did here. I want to make sure your call light's in place. If you need anything, just let me know. How are you feeling? Feels like you're getting some relief? That's awesome. Okay, I'll go take care of the charting. So for charting, what I'm going to do is I'm going to talk about how the insertion went for the patient, how well he tolerated it. I'm going to mention what size Foley catheter is in place. I believe we use a 16 French. I'm going to talk about the color, consistency, clarity of the urine that came out, do a description of that urine, and mention that I took a specimen down to sent a specimen down to the lab. And I think that's it. So if you guys have any questions, you can ask Linda and Renee after you've watched the video. Thank you.